Today on Cancer Buzz, research-based tactics to empower caregivers. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This is the first episode of a 4-part series on caregiving, starting today with psychosocial care options. Cancer care team members know how challenging being a caregiver can be. It can take a toll on your finances, emotional well-being, and physical health, which often leads to depressive symptoms and mental health problems. Our guest today researches the impact of stress on caregivers. Allison Applebaum is a psychologist at Memorial Sloan Kettering Cancer Center in New York City.
I have the gift of directing the Caregivers Clinic at Memorial Sloan Kettering Cancer Center, which is the first of its kind in this country, targeted psychosocial service explicitly focused on supporting caregivers. And it's a gift in part because what we can do is once these interventions have been developed and tested for efficacy, we then can implement them in clinical practice in the Caregivers Clinic. And so we do strive to rely on empirically supported interventions, including, for example, the cognitive behavioral therapies upon which that emotion regulation therapy is based, as well as meaning-centered psychotherapy. So we are able to very directly implement the interventions that have been developed and tested.
Can you walk us through meaning-centered psychotherapy?
Absolutely. So meaning-centered psychotherapy for caregivers is a brief 7-session intervention that focuses on helping caregivers to connect and reconnect to various sources of meaning in life. I'm going to give you an overview of the 4 categories that we talk about across 7 sessions. They include the historical source of meaning, which is the meaning that we derive through reflecting on the fact that we live life in a context, that nothing happens in a vacuum, and that the caregiving role occurs in this context and very much can shape the legacy that we will live in the future. We talk about the attitudinal source of meaning. This is a funny word, but really what it gets at is the idea of choice. So many caregivers feel like they had no choice in becoming a caregiver and oftentimes feel disempowered during their caregiving journeys. Through discussion of attitude taking, we can help caregivers to connect to the ways in which they can choose to respond to the limitations and losses they face in the context of caregiving, and that can be very empowering. The third source of meaning is the creative source of meaning, and this is the meaning that we can derive through how we put ourselves into the world and create our lives. And it really focuses on encouraging caregivers to continue to do so despite the limitations they're facing. And the fourth source of meaning is what we call the experiential source of meaning. And this is the meaning that we can derive through experiencing life through our 5 senses. And through feelings of love and visions of beauty and moments of humor, caregivers can feel connected to one another and connected to their loved ones. It's something much greater than themselves. And so across these 7 sessions, we help caregivers to realize ways in which they can utilize these sources of meaning.
How have you seen its impact on caregivers?
Over the course of the past decade, from the development of this intervention to the pilot testing, and now we're in R01 phase of testing efficacy, we've been able to show, despite increasing caregiver burden, and in my most recent pilot trial, this was a pilot trial among caregivers of patients with glioblastoma, many of whom patients died during the course of the trial, so caregivers became bereaved. Despite increasing distress, despite in some cases bereavement, caregivers who had received meaning-centered psychotherapy were able to report an enhanced sense of meaning and purpose in life, generally, meaning and purpose in caregiving specifically, an enhanced sense of spiritual well-being and benefit finding, as well as decreased depressive symptomatology. And so I think it really has the potential to serve as a powerful tool for caregivers to use in the context of their experiences. And I think why it's so powerful is that it does not negate suffering. The underlying idea here is that suffering and meaning can coexist. And so despite the suffering of caregiving, we can, through these sessions, help caregivers to connect to the good stuff.
Why is it important to have different forms of therapy available to caregivers?
There is no one-size-fits-all approach to supporting caregivers. Caregivers' needs fluctuate across the caregiving journey from diagnosis through bereavement, and we need a variety of tools to be able to support caregivers in their unique needs across the trajectory.
What does the future look like for this work?
Over the past decade, my research has focused predominantly on the development of psychosocial interventions for caregivers, but more recently, I've become very interested in the systems level issues and challenges that we face in incorporating caregivers into care. And of course, recognizing we are already in a very overburdened healthcare system where many patients with cancer are unable to receive psychosocial support. And not every cancer center has a caregivers clinic. So more recently, I've been evaluating the benefits of various distress screening protocols that can be used to help identify those caregivers who are really in greatest need of support with a psychologist or psychiatrist or social worker versus those who may benefit more from psychoeducation or whose distress is really driven by a need for education about how to take care of their loved one at home. And I think that it's very important as we move forward and think about really addressing the needs of cancer caregivers that distress screening protocols are placed early so that we can maximize the use of resources that we have in our already overburdened healthcare system.
Thank you for tuning into this episode. Make sure to check out the show notes for more resources on caregiver mental health. And don't forget to follow the Cancer Buzz channel so you'll be the first to know when there are new episodes in this series. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.